In my world of liver transplantation, it really is a team sport, and you need a lot of people to make a transplant happen. And it begins in the community.
My practice is at Jordan Valley Medical Center. I work as a hospitalist, so I don't have a clinic. I just see adults when they're admitted to the hospital with an acute illness, usually.
I came into the hospital because I was swelling up. I was yellow. My eyes were turning yellow. I was very uncomfortable and could hardly breathe.
A lot of the providers in the community have not been trained. They've not been trained in complex liver disease and liver transplantation. And they're kind of burdened with caring for very complex medical patients.
I first talked with Dr. Ray Thomason about a patient at Jordan Valley. He kind of gave me all the information I needed and all the reassurance I needed and helped me better to clarify what was going on with that patient.
One of the many resources that I try to provide the community providers, education and awareness of who actually really will qualify for listing for transplantation.
We think a lot of patients who are potentially great candidates for liver transplant get overlooked. Depending on the social constraints, the stigma, many programs or even referring providers may not refer a patient to a transplant center because they think that we make decisions based on stigmas and moral values. In other instances, we think that transplant patients or potential transplant patients are turned down in advance because people think the patients are too sick.
Dr. Belknap came to me and told me that I had liver issues, and he recommended me to go see the doctors up at the University of Utah.
The most important thing I've taken from Dr. Thomason is these patients are really, really complicated, and it's okay to feel like it's a challenge to manage them. But it's not worth giving up on the patients. It's worth doing everything you can and getting them into a transplant center like the University of Utah.
Everyone deserves one look. Everyone deserves the opportunity to be considered by a transplant center.
We went up there and had all of our tests and blood work done, and met with Dr. Pham, and he thought that I would be a good candidate for liver transplant.
I was on the waiting list for a week. They told me I didn't have much longer to be alive. They came back in the afternoon and evening and said, hey, we found you a kidney and the liver. I was ecstatic.
It's given me a whole new look on life. You kind of change your perspective, you know, makes you appreciate your kids. I've got 2 kids and love them to death.
We realized many years ago that one of the problems that patients had in order to get a transplant was that their families weren't supported. And we created patient family housing. And what that does is it creates a community where our patients and their families can relocate temporarily, easily access a hospital, and reap the full benefits of the University of Utah's transplant programs. Because the University of Utah has such a broad catchment area and it spans 4 states, we have to make sure that patients who come from afar are able to get this similar or same care through their own local providers. One way we do so is via the telemedicine program.
We appreciate your efforts and willingness to donate.
The Division of Transplantation is only one part of the transplant service line. The University of Utah has an incredibly adept and well-qualified multidisciplinary team.
We're set out to take care of the whole spectrum of patients with chronic liver diseases, such as non-alcoholic fatty liver disease and its complications, liver cirrhosis from viral hepatitis, and of course, liver cancer in all its forms.
We dovetail very closely with the Huntsman Cancer Institute, which is a comprehensive cancer institute.
One of the cutting-edge treatments that we provide at the University of Utah is radiation embolization of liver cancers. We also provide treatment for patients that have cholangiocarcinoma or cancer of the bile ducts.
The care I received in the University of Utah was awesome. Every doctor that I've dealt with, every nurse I've dealt with were just professionals, knowledgeable, caring. I could not have had a better experience.
I would recommend the U to anybody. I love that place.